Okay, we're going to take a look at the professional introduction once again, but this time we're going to take a look at it and how to modify it when we need to. And to be honest, there will be a lot of times when you may need to modify it because of time, because you may have worked with the same provider before or the same patient before. And so when we are in the real world, in a clinical setting, with a real assignment, with a real patient and real healthcare providers, there are many things that can happen and that it can affect the situation and make it different than what we're used to in the classroom. So what we want to do is we want to prepare for situations that are not typical and we don't freeze or can't figure out how to proceed because we cannot do things like we normally do them. Now, this is a funny situation that sometimes is common where I've had students or I've met other instructors of students who really want to use the protocols that they learned in class. They're eager to practice things that they have learned in the classroom. They're good students, and so they want to follow the protocols and are excited to interpret at a professional level and to distinguish themselves as a trained interpreter from an untrained interpreter. But I have said it before, and I will say it again, that your critical thinking skills are going to be very important. It's going to be very important that you develop that knowledge of what it is to work in a healthcare setting and to work with real people. This is one of the reasons why I have said before that very much interpreting and healthcare are customer service oriented professions. So there are certain elements that we need to include, and this is in page 94 of your textbook. We said that with our introduction, we introduce ourselves and who we are, and that helps with transparency, and it also helps to avoid any confusion of the role of the interpreter and your role as the interpreter. It also lets participants know, especially the patients, that you are going to keep everything that is said confidential, because we've said that they know this about providers previously, but if they've never worked with an interpreter before, they may not know that it is okay to continue as if you weren't there, because you will keep their confidentiality. We ask them to speak in short phrases. That's very important for accuracy and completeness. We also let them know to speak to one another to support transparency. And then we also let them know that we have to interpret everything for completeness. And this part is very important, especially as well, because again, if you do not have experience working with interpreters and you say something that maybe you did not want interpreted, the interpreter has to interpret it. And so it's a really good idea for the interpreter to mention it to avoid any awkward situations or someone asking you not to interpret something that they have said. And then now you are placed in a dilemma because of the need for transparency and completeness. Okay. But let's take a look at some scenarios where, for example, you may not have time to do it. We should always try to do it, try our best to do it. But we should understand that we are not in charge of the encounter, the participants are. And so we are going to use our critical thinking skills, just like we have done in the past with other protocols. For example, when we have figured out where we should stand and figure out, okay, what is the purpose of this? What do I want to accomplish by providing the participants with the information from the professional introduction? Okay, so the purpose is to ensure that everyone knows that I am the interpreter, what my role is, and how I will be doing my work, right? Informs participants of your role, who you are, what you do, and how you will do it. And because we want to establish a professional and appropriate rapport. Okay, so now if actually saying the words is actually delivering it, it's going to negatively affect the rapport that I'm trying to build, then I need to evaluate whether it's necessary or not. And so that's what we want to look at today, is that sometimes it will not be possible. We'll take a look at some situations and some examples, but we also know that even though it may not be possible, that we still have to abide by those protocols, those things that we usually say and include in our professional introduction. We still have to do them, even though we didn't get a chance to communicate them for whatever reason. And so I wanted to let you know that I do have situations where students are excited to practice their protocols and they sort of force it. So we need to learn to read the room. We need to learn how to use our critical thinking skills and understand what our main purpose and our role is, and not get in our way with our protocols and not actually have our protocols work against us. So I've said it before, you've read it in your book, that yes, here are a bunch of rules, but we need to know why they're necessary, and here are the best ways to get those things done. But because you are a person with a brain and with critical thinking skills, you may need to modify to still make sure that you meet those goals, but in the best way possible if the perfect way is not available. And I have worked with students that sometimes tell me, well, Professor, I don't ever get to do my professional introduction out when I'm doing my practice hours. Or they say, I have been shadowing 1, 2, or 3 interpreters for my hours, and I've not seen anyone actually do the professional introduction. And there's going to be different reasons why. We'll talk about some of the situations that may present in a clinical setting, in a hospital setting, that might make it impossible or might make it a situation where it's not a good idea to take the time to do the professional introduction. Another reason why might be because the patient and the provider and the interpreter have worked together before. The interpreter might know that both of these participants usually know how to work with interpreters. They already follow the rules. They are knowledgeable about how to work with an interpreter, and so it may not be necessary to repeat yourself, right? Situations where the assignment has already started for whatever reason, whether it be because the patient arrived early, because it's an emergency, because they forgot to call an interpreter and they asked you to come in later than the start time. Sometimes it's just we are running behind. The provider has a ton of other patients to see or a ton of other tasks to do. They just want to get started with the patient. So we have to remember that we are in charge of making sure that what is said by one person is understood by the other to the best of our ability with our linguistic and cultural knowledge. But the people who are in charge of the encounter are the participants, are the patient and the provider, and whoever else is in the encounter. That's why we learned about communicative autonomy. So we are going to evaluate the situation. Is this not a good idea to do it because it's going to negatively affect the encounter? Or do we have time? Are these folks not giving me time to do it because they don't know that I have a professional introduction to deliver, to inform them about? So you're going to have to decide, and sometimes it will be that you won't be able to do it. Again, just because there is a way to do our job without following this protocol, that's not what we are going to strive for first. We are going to always strive to actually follow our protocol, But then we are also going to talk about what to do when it's not possible. So firstly, even if it's not possible, we are still going to continue to follow all of those things that we say we do during our professional introduction. We are still going to maintain transparency. We are still going to let folks know that everything that is said is going to be kept confidential. We're still going to encourage them to speak in short phrases, short sentences. We're still going to ensure transparency and completeness. So how do we do that? When we are able to deliver our professional introduction, we just say it. Hello, my name is Jenny. I'm an interpreter for ARC and will be the interpreter during your appointment. There, I'm introducing myself, telling you what my role is, etc. Okay, so what if I can't say it? Then I'm going to give you that information with my actions, with my demeanor. So that's why it's going to be very important that you always carry your badge where it is visible. So first we are saying, hey, I'm a professional. Here's my title. Here's my name. Here's where I come from. So I'm identifying myself in that way. I'm also going to do it with positioning to make sure that my role is clear. I'm going to position myself in the most unobtrusive position to minimize the chance for role confusion, right? So I'm not saying it, I'm doing it. And with confidentiality, you may think, well, there's not anything that I can do that will explicitly let someone know, but there are things that you can do to make sure that people trust you. So your demeanor, right? The way that you speak to people, the way that you communicate with people, the way that you dress and introduce yourself as a caring professional. And this is going to help participants trust you, that you are a professional in a healthcare setting that is responsible for keeping confidentiality. Now, yes, there might be folks who don't know that professional interpreters also have to follow HIPAA and so on and so forth. But again, this is what we're doing. This is why this is not our first line of defense, right? This is the second to best thing that we can do. If we can't tell you, we are going to show you. And then we're going to make sure that we are managing the communication flow. So for example, what we're going to be doing is if someone is speaking for a very long time, we are going to use either hand signals or wait for a natural pause in their speech to start interpreting so that we guide them to let them know that we need a break for interpreting. If it's an emergency situation, then we are going to then evaluate whether it would be pertinent, whether it would be a good idea to interrupt or start interpreting in that a natural pause. If it's an emergency, we may not get those pauses. So then in that case, what we could do is we are still responsible for interpreting everything. So we may have to switch to a different mode of interpreting. For example, going into simultaneous interpreting. And transparency. Again, even if we didn't get to say it, we are going to be interpreting everything exactly as it is said. So we are still going to use the first person. So let's say we didn't get to do a pre-session because the situation just got started. And even though we might not know that these folks have worked with interpreters before, we are going to start our interpretation. And sometimes folks will get it right away, but in situations depending on the language, on the culture, or the situation, for example, an emergency situation, it might cause confusion. Again, we, in that case, could take a moment to evaluate and decide whether we should intervene to clarify and mention, okay, I didn't get to say it at the beginning, but I'm going to be using the first person, interpreting everything as you say it, or you think it might cause more confusion, then maybe switch to the third person. And we're going to, of course, interpret everything. And then completeness, we are also going to let folks know that we are going to be complete with everything that is said, interpreting everything that is said, because we're using the first person and because of how we position ourselves. Now, I did say that I have worked with students who have told me I don't usually get to do it, and sort of hear that feedback, but I have also received feedback from providers who, and it just reminds me of two very specific cases. Now, remember, I've been training interpreters since around 2005, 2006. And I do remember two specific situations where I was told by a provider or by a manager that they didn't like working with that student because they insisted on doing their pre-session. They insisted on standing in a certain spot. They insisted. So basically, they showed no flexibility. And so what happens when you do that is that you forgo your transparency. You're no longer transparent because you're now arguing with the provider or the patient. You're now inserting yourself and saying, okay, we have to, I know this is your appointment, but we have to make sure that I get my protocols communicated or my protocols out of the way. If you always go back to the main purpose of the interpreter, which is to facilitate communication, our job is to make it easier for two folks to communicate. But if we are now arguing and imposing our protocols, then we are not making things easier. And then I have gotten that feedback where it's sort of a show of a lack of patient-centered care and a lack of critical thinking skills. So let's take a look at some example scenarios. Okay, in scenario 1, as soon as you arrive, the nurse practitioner says to you,
"Thanks for coming down. This is Mom and baby Ahmad. He has a fever and he's having to work hard to breathe. That's as far as we got. But I need some more information from her. Can you ask her Ahmad's date of birth?"
And that's it. No hello, no nothing. As soon as you get there, the nurse is polite, but she gets right to it as well. And so what do you do in that situation? So one way is to let the provider know that they will briefly introduce themselves to Mom and then interpret. So we do this because it is obvious that the nurse practitioner already knows that you are the interpreter. But we now need the patient's mother to also know who you are. And you are going to be adding that information. So you want to be transparent and let the provider know that you're going to introduce yourself and then, of course, interpret their request. So the interpreter could say, "Yes, I will gladly interpret everything you say, and I'll do it in the first person, so it's like you're communicating directly with one another." So here you are answering the person's question, you're answering the nurse's question. You're also sneaking in a shortened version of your professional introduction. See if you can spot which part of the professional introduction I have in there. In there, you will see that I have snuck in the part about completeness because I have said, "Yes, I will gladly interpret everything you say and I'll do it in the first person." So I'm also sneaking in the part about the first person, about direct communication. So first person, so it's like you're communicating directly with one another. It's like a Jedi mind trick. And then, of course, to be transparent, you're going to say to the patient, "Hello, I'm an interpreter." So there you're introducing yourself. "The nurse has explained to me that Ahmad has a fever and is having trouble breathing." Now you're being transparent so that the patient's mother knows what the nurse has said to you. She needs more information from you. I'm now going to interpret everything exactly as she says it and interpret the same for everything you say. What is Ahmad's date of birth? Okay, so here we're not taking the time. See, we're not stopping to say, wait a minute, let me do a pre-session first. We are not ignoring the nurse practitioner's request to get started. We're not ignoring the situation, which is that a baby is having trouble breathing, which may constitute an emergency, and the fact that these two individuals, the patient's mom and the nurse, have already begun their interaction. So we are taking all of that into consideration, but we are still introducing ourselves, doing a mini pre-session, and then of course taking into consideration that they are wanting to get started, include that what is Ahmad's date of birth, which was the nurse practitioner's request. Okay, mom says August 1st, 2021. The interpreter says Ahmad's date of birth is August 1st, 2021. Now, the reason why you see that here the interpreter actually voiced Ahmad's date of birth is August 1st, 2021 is because there has been quite a lot that has happened between the time the nurse asked for the date of birth. And so to add back some context, the interpreter has said Ahmad's date of birth is August 1st, 2021. It's not an addition because that is indeed what the date means. Okay, in scenario 2.
Thanks for coming down. This is Mom and baby Ahmad. He has a fever and he's having to work hard to breathe. That's as far as we got. But I need some more information from her. Can you ask her Ahmad's date of birth?
Okay, in this situation, you can see that there is a crying baby. The encounter has already begun, and so it feels like it needs to be a little quicker. And so the interpreter chooses to respond to the nurse practitioner by saying, yes, I will let her know I am an interpreter, then interpret your question. And so here, the interpreter is not foregoing transparency. So she doesn't say, I'm an interpreter, because the provider knows that already, but goes into interpreting. However, lets the provider know that she will be introducing herself to the patient mother quickly. And so in that case, still we keep with completeness and transparency. To the patient's mother, the interpreter says, hello, my name is Yenny. I'm an interpreter here to help you both communicate. What is Ahmad's date of birth? So here again, the interpreter is introducing herself so that her role is clear, and then jumps right into interpreting. Okay, and let's finally take a look at scenario 3.
Thanks for coming down. This is Mom and Ahmad. He's having to work hard to breathe. That's as far as we got. But I need some more information from her. Can you ask her Ahmad's date of birth?
Okay, so this case is far more urgent than the ones that we have seen. Clearly, the child is having trouble breathing, and mom probably didn't have to say much, and the nurse practitioner didn't have to ask much to see what the problem is, because it's very clear that he is having trouble breathing. He's sitting in a tripod position. He is using accessory muscles in order to help his body breathe. So clearly, it's also not a good time to take time away from caring for the patient to do a professional introduction. So I will be interpreting what is Ahmad's date of birth. Again, no need to introduce yourself to the provider in this situation because the provider already knows who you are, but you are going to introduce yourself to the patient's mother. As you can see, there were a lot of people in the room, and this is going to make it even easier to confuse your role. So it takes nothing but a nanosecond to just let the patient's mother know that you will be interpreting, and then jump right in. And again, it's still an introduction, but it is going to be one that is very quick. You get one thing that you get to say and then start right into interpreting. And then the rest of the protocols you are going to model like we talked about at the beginning of the video. Okay, so then the mother responds, he was born on the 16th of August, 2007. I want her to check his chest because he's making a weird sound when he breathes and his chest sinks in more than normal when he takes a breath. Okay, so in this situation, mom has given the answer to the question, but also she is worried, right? And most likely is happy that you are there and has had questions. And now that there is someone that is there to help her communicate, she is going to want to ask questions and communicate all the things that she hadn't been able to do so before. So you see here that although the patient mother has asked the question in the third person, the interpreter is going to interpret it in the first person to reinforce those protocols. The interpreter is going to monitor the encounter to make sure that using the first person is not causing confusion for the participants. Again, because it's an emergency and there was no time to do an extended introduction. And the mom is in a tough situation watching her son go through something that is difficult. And even though the interpreter might have said, I will be interpreting, so as to let her know what the interpreter's role is, she might not have heard it because she is so worried about her son. So the interpreter is going to monitor the situation, monitor the communication. And if the first person is causing confusion, then the interpreter should evaluate the situation and then make a decision on whether the interpreter changes to using the third person or to intervene. And if the interpreter decides to intervene, she could say something like, as the interpreter, I'd like to point out that I am merely interpreting exactly what you say from one language to another. I am not part of the healthcare team, or I am not fill in the blank as to what the issue is.